take your notes. So reticulocyte count, okay? Reticulocytes count. Reticulocytes count. All about reticulocytes, not only count, we'll discuss everything. Listen, what is the function of reticulocytes? What do you know about reticulocytes? They are immature red blood cells. Right? So before red blood cells coming to the circulation, just before 48 hours, okay, the cells will be in reticulocyte stage. After reticulocytes, they will become a red blood cell when they are migrating from bone marrow. So a quick definition or introduction. So reticulocytes are immature erythrocytes, okay, released from bone marrow into the peripheral blood, okay, circulation blood. They still contains remnants of particles. They are ribosomal RNA will be present, okay. That will make a reticular mesh, hence called as reticulocytes. Okay. Now, reticulocytes will be visualized with the help of supravital stain. Okay. The stain that we are using for reticulocyte staining is called as supravital stain. The meaning of supravital means these are the class of stains that can able to stain a living cell. Any stain that can able to colorize a living cells are called as supravital stain. Okay. In this case, we are using a supravital stain. They are either new methylene blue or brilliant freeside blue. We can use either brilliant freeside blue or new methylene blue can be used for the identification of reticulocyte. Okay. So, yeah, what is the major function of reticulocyte? The major function is reticulocytes is the direct indication of bone marrow response. Okay, we know that when a bone marrow responding, okay, a healthy bone marrow should able to produce the red blood cells. Before producing red blood cells, it should make the baby cells. Baby cells means immature cells. They are the reticulocytes. The number of reticulocytes, the normal percentage is 0 to 2%. Okay. 0.5 to 2.5% is the normal reticulocyte count. So hereafter I will write RC for reticulocytes rather than writing. Okay. So this is the normal count. Normally we should see around 2% of reticulocytes in the circulation. Okay. Now let us imagine maybe the person bleeding excessively. So he is bleeding a lot from the blood vessel. Okay. When there is excessive bleeding, what happens? Blood loss happens. Blood loss happens. So bone marrow will synthesize more red blood cells. Okay. When bone marrow producing more red blood cells leads to 4 to 8% of reticulocytes. Leads to increased number of reticulocytes. So that is why increased reticulocyte indicates a good bone marrow response. If reticulocytes not increasing even during a blood loss condition, that indicates bone marrow is a fail or some issue. That means decreased reticulocyte count indicates bone marrow failure, aplastic anemia, severe malnutrition, that means vitamin B12, folic acid, etc. deficiency, or positive side, if we are getting good response, then okay, these are the conditions for decreased reticulocyte count. That means reduced bone marrow response. Whereas increased bone marrow response is an indication of recovery from the chemotherapy, recovery from chemo. What do you mean by chemo? Cancer therapy. Okay, recovery from the cancer therapy. Good prognosis. Good prognosis to therapy. Prognosis means healing. Okay. After giving a treatment, how well the treatment, how well the treatment done to the body, okay, to the patient. Yeah. So that is called prognosis. So there are few conditions. So in a nutshell, reticulocytes reticulocytes plays a vital role to determine the bone marrow activity. That is clear for us. To understand whether bone marrow responding properly or not, or healthy status of the bone marrow, we are checking the reticulocyte count. Now there are some problems in clauses. What are those clauses? Clause number 1. Okay, first one, normal reticulocyte count. We are doing regular reticulocyte count, very easy. Making a smear. Whenever we are saying percentage, we are correlating it with something else. How many red blood cells present? Out of these red blood cells, how many reticulocytes present? Okay. If there are 100 red blood cells, 2% is 2 reticulocytes should present. For every 100 cells, 2 reticulocytes should be present. That is the normal. Okay. That is good. Well, but we get to know some problems. I don't want the comparison of red blood cells. I need the real only reticulocyte count. I don't want percentage value. I just want the actual count of the reticulocyte. In that case, we are doing one more test that is called absolute reticulocyte count. Absolute reticulocyte count. Here we are going to count the actual reticulocytes. We don't compare with anything. Okay? Absolute reticulocyte count for 1 microliter of blood. How many reticulocytes present for 1 microliter of blood? We are not cross-checking with the RBCs here. How many cells present for 1 microliter blood? That is called absolute reticulocyte count. Okay. Then next one, third one. The third one was, now listen, there will be some problems. Let us assume. The patient has an anemia. Okay. Patient has malaria. Or not malaria, malaria is a hyper condition. Maybe patient actually in anemic status where patient's red blood cells are less. Okay. When we are counting the normal reticulocyte count, if the red blood cell count was already less, then this count looks more. It looks like 3%, which is normal. Because here now cells are reduced. Now red blood cells reduced, so even though they are normal count, they look like more. Okay. That is the problem with anemia. Now, in case of anemia, we need to check how many cells were reduced, how many red blood cells reduced. To that population, how many reticulocytes are present. That is called corrected reticulocyte count. Corrected reticulocyte count. Corrected reticulocyte count is in comparison with anemic status. Anemic status. Depending on the anemic status, how many cells are present? That is called as corrected reticulocyte count. Is it clear so far? First we check the direct reticulocyte count. We are comparing it with how many red blood cells available. Second one, we went for only counting of reticulocytes for 1 microliter of blood. In third step, we done how many reticulocytes present in an anemic status. Okay, that is called corrected reticulocyte count. Clear? Now, rather than correct, all these things are one story. The other story is, I want to check how many cells were actually produced by my bone marrow. I want to check the bone marrow functionality. How many cells it can produce for 1 hour. Okay, I want to check the reticulocyte production of the bone marrow. How many reticulocytes are produced by the bone marrow within last 1 day with time. Okay, that is called reticulocyte production index. Reticulocyte production index. This will give more details about the bone marrow activity. Okay, reticulocyte production index. How many reticulocytes produced by the bone marrow? We are going to check its production activity. Production. Next one. See, we thought only one reticulocyte, but there are many ways to measure. Then, sometimes, okay, reticulocytes themselves were classified into 4 stages. Okay, Yeah. Before a reticulocyte becoming a red blood cell, okay, the time it takes for a reticulocyte to convert to red blood cell, the time is 48 hours. Okay, more reticulin fibers, less, no more. So, how a reticulocyte converted to a mature red blood cell? Okay, it takes around 48 hours. Okay, now I want to check these particular cells in the circulation, not this. How many this just now produced, the new freshly produced cells in the circulation. Why I need this freshly produced cells means these cells will give the actual real time right now what is the condition of bone marrow. Right now, just half an hour ago, how many cells produced by bone marrow? Not last 48 hours. To check the real time monitoring of bone marrow, we can check these cells. These cells are called as, since the reticular fibers are so condensed and compact, they resemble like a nucleus, but not nucleus. Hence, these cells are also called as immature nucleated reticulocytes, or this test is simply called as immature reticulocyte fraction. Immature reticulocyte fraction. In this test, we are going to check the nucleated, pseudo-nucleated, nucleated is a wrong term, nucleated reticulocyte we will check. Okay. I know people in the YouTube class, sometimes they will come and you said this wrong. So I know what I'm saying. Yeah, that is immature reticulocyte fraction. Okay. Is it clear? So we are going to discuss all these things, and also maybe I will discuss introduction already done, then definition already done, then physiology. You already know the physiology. It's all about how a early normoblast conversion to late normoblast reticulocyte and reticulocyte. That's the pathophysiology. Then we will also discuss about their normal values, their clinical significance, and partly that's it. Result interpretation. And also, even though we have multiple approaches to check the reticulocytes, still there are some problems, some limitations. What are the limitations? We will check. If you can't be able to understand, the most challenging medical condition to cure or to treat was always leukemia. If anything that is touching the blood means that's it. The chances of treatment is very less. All other organs can highly respond to treatment, but not the bone marrow. And also, that's why blood is called as fluid of life. If something happens to blood, the death was very near. So yeah, that's why we need to be cautious. The chances of survival is very less, and our opportunities are very minimal. So we are trying to grab as much as information to save the patients. That is the main agenda why we are by having these values. At the end of the day, we are trying to save patient lives. Keep in mind, okay? Sometimes we will forget why we are doing this. At the end of the day, it is not about these values, it is about saving a patient. And another problem is blood cancers. Patient looks normal. He looks completely normal. There is no visible swelling, etc. nothing. But he will die in the next few weeks. One of the most silent killer, blood disorders, leukemia. So leukemia can be captured with whatever lab test we are doing, especially in oncology. Yeah. So introduction is clear. Reticulocytes, they are immature cells. They can be stained by supernatural stains. Of course, the counting can be done manual methods and automated methods. At the end of the day, we are applying some formulas to gather these information. So a quick recall. What is the full form of CRC? Collected reticulocyte count. Then ARC means? Very good. What is the normal reticulocyte count? 0.5 to 2.5%. Normal reticulocyte count. Very good. So yeah, this is how a reticulocyte looks in PBS, peripheral blood smear or film. Okay. So you can see a red blood cell with some depression in the center, and you can see a suspended particles. And this the stain that we use, I know it's somewhat blurry here, but anyway, this stain is for the supravital stain. We use brilliant drizzle blue, okay, for staining it. So that's it. The normal value is 5 to 2.5%, 0.5 to 2.5. Then yeah, as I said, reticulocytes is the direct indicative or marker for the bone marrow activity, bone marrow response, bone marrow ability to produce blood cells, particularly RBC. So definition, a quick definition. A reticulocyte is an immature anucleated red blood cell containing residual RNA and organelles that are visible as a blue stained reticular mesh when stained with a supravital stain. That is the basic definition. Okay. No need to write a diameter and all. Diameter will be slightly larger than RBC. RBC is around 7.2. Here it is 8 to 10 micrometers. Okay. Very good. And the maturation, how long it will take for the reticulocyte to get mature? 48 hours. Translated to 2 days, roughly. Right? Yeah. So during the transformation, yeah, this is how it looks at the beginning. So eventually it will become a red blood cell. So these are called nucleated RBC. When we say nucleated, it's not nucleated, it's actually the reticulated. Okay. But visibly looks like a nucleated. Okay? Yeah. And a reticular and mature RBC. Simple. Okay. Reticulocyte maturation. In what lab test we are going to check the just bone reticulocytes? In what lab test we will get this cell identification among them? Immature reticulocyte fraction. This will give the status of this one or real-time monitoring of the bone marrow. Clear? Yeah. I didn't make much slides. Whatever I've discussed will be material based. So I hope you got some clarity about what are reticulocytes in a nutshell. Right? Yeah. So definition we know, morphology we know. Okay. Physiology, how reticulocytes are produced. Obviously they are produced in bone marrow from late normoblast. The nucleus is excluded, that means removed through bone marrow. They will be circulated for 20 to 48 hours. So that's it. After 48 hours, reticulocytes will be converted to red blood cell. Okay. Reticulocyte count reflects erythropoietic rate and bone marrow health. Erythropoietic means production of red blood cells. Erythropoietin, the hormone that is responsible for bone marrow to produce cells. If you remember erythropoiesis in your second semester of physiology. Anyway, yeah. The first one. Write down importance of reticulocyte count. What is the importance? Just write very bullet points, okay, short bullet points. Real-time measuring of the bone marrow response to anemia or therapy. Write down these points. A rapid real-time measure of bone marrow response. Increased reticulocyte indicates active bone marrow active bone marrow involvement, and decreased count indicates bone marrow suppression. Okay. Clear. Next. So, and just increased bone marrow is seen in increased RBC destruction cases such as hemolysis, acute blood loss, and post splenectomy. Okay, yeah. Clear. Whereas decreased count indicates bone marrow failure. So increased count means more destruction of blood. Decreased reticulocyte count indicates bone marrow failure. So okay, they are in two spectrums, two ends of the spectrum. Okay. So coming to the counting methods, obviously we have manual methods and the automatic method. Coming to the manual method, the first one will be the PBS. Okay. We are making a peripheral blood film. How we are making? Upon making the film or smear, we are going to use a supravital stain. So take a slide, make a smear, apply the vital stain, and go for checking the cells. Okay, that is the manual method. Manual method is PBS. Clear? Yeah. So procedure you already know. Take the blood, add a drop, I don't want to go. Oil immersion. We need to count in oil immersion. Keep in mind, not 40x, but oil immersion. That means 1000x. Clear? Yeah. This calculation important. Reticulocyte count calculation. Write it down. Formula. How to calculate a reticulocyte count. Very simple. Reticulocyte percentage actually. When we say percentage, we are checking is something. Number of reticulocytes counted divided by total number of red blood RBC counted into 100. Okay? How many reticulocytes we counted divided by the total number of RBCs in that area, in the field. We will give you this one. Okay? Hardly 50 rupees lab test, but it will give so many insights. Okay? So this is the formula for reticulocyte count. Clear? RC count equal to RC count divided by RBC count into 100. Clear? Now, next one. Absolute reticulocyte count. When we say absolute reticulocyte count, here we are going to only count the reticulocyte, not in comparison with RBC, but with 1 microliter of blood. So let's see what is this. Of course, everything has its own advantage, disadvantages, inexpensive, but limitations are there. Okay. Limitation will be, she will count 20, he will count 60. So everyone have their own opinion based on their vote. Sometimes that happens when we are doing language. Or maybe I'm taking lab at 4 o'clock. Then you will be quick. Then automated methods. In the automated now, we are using our flow cytometry, classical good old flow cytometry for reticulocyte count in automatic, right? Yeah, this is you already know. Yeah, write down this one. Absolute reticulocyte count. Write down this simple definition and its formula. Maybe I will ask in this first interval also. Up to reticulocyte count, I will ask in first intervals. The next SLE we will discuss in second interval. Let me see. Yeah. So ARC, absolute reticulocyte count means it is the count per microliter of blood that equal to reticulocyte percentage into RBC count per microliter of blood divided by 100. Okay, per microliter of blood. Please keep in mind. Okay, that's it. And I given one example also. For example, if your count is 2% and your RBC count is 5 million. Then ARC will be 2 into 5 million divided by 100. That equal to 1 lakh reticulocytes. Okay. Yeah, this is how we are doing. This is called absolute reticulocyte count, where we are comparing in 1 microliter of blood. Right? Yeah. Next. Corrected reticulocyte count. What is this corrected reticulocyte count? What is its significance? We will check in comparison with ongoing anemia status. Okay, reticulocytes with anemic status. Write down. The next one is corrected reticulocyte count. Corrected reticulocyte count. Corrected reticulocyte count. Write it down. Write down the definition. Reticulocyte percentage needs correction in anemia because RBC count is reduced. Because in anemia, RBC count is reduced. That is why the reticulocyte need to be corrected. RC count need to be corrected. Reticulocyte percentage needs correction in anemia because RBC count is reduced. Alright, write down the formula. Sorry. You know what is hematocrit means? What is hematocrit? What lab test is called hematocrit? PCV, very good. So we will compare with PCV. PCV is always a golden standard for anemia detection. The status of anemia can be determined very well with PCV. Keep in mind. So that is the formula. Write down. CRC, corrected reticulocyte count percentage, is equal to observed reticulocyte percentage into patient's HCG. By the way, I hope you are writing your normal values for each and everything. So CRC percentage is equal to observed reticulocyte percentage into patient's normal, patient's PCV value divided by normal PCV value. Yeah. Patient PCV value by normal PCV value. This is about corrected reticulocyte count. Okay. Next. The next one is reticulocyte production index. Reticulocyte production index. What does it mean? It will check the status of the production rate, the rate of the production of reticulocytes by the bone marrow. That is called reticulocyte production index. Write down the definition for this one. The definition goes like, it adjusts corrected reticulocyte count for early release of reticulocytes from bone marrow in anemic condition. As you said this. In anemic condition, how many reticulocytes produced? Adjusted, it is an adjusted corrected reticulocyte count for early release of reticulocytes in reticulocytes by bone marrow in anemia condition. Right? Definition clear, right? Write down the formula. The formula goes RPI equal to CRC by maturation time correction factor. Yeah. Maturation time correction factor is given in a table in the kit, okay? So there is a small table that will give the correction factor. For example, like this. This is the correction factor. Okay, write down. Maturation time corrections also write down. So the kit is the hematocrit percentages for days. The maturation time it is done like that. Reticulocyte production index is equal to CRC by maturation time correction factor. The correction factor is here. Let me drag it like this. Yes. All right. Clear? Okay. So write down the interpretation of RCA production index. The interpretation goes like RPA greater than 3 indicates appropriate bone marrow response. RPA less than 2 indicates inadequate bone marrow response. RPA greater than 3 is appropriate response. Less than 2 will be the inappropriate or under response of bone marrow. Clear? Yeah. Next, and I guess this is the last and final one. That is immature reticulocyte fraction. Maybe in our next lab we'll go for a reticulocyte staining. Okay. So try to next Wednesday, I hope you know there is a lab test. Do you remember? Yeah. Get ready for it. First 2 experiments, experiment 1 and 2. The next Wednesday. Okay. Last and final, immature reticulocyte fraction. Write down the definition. The proportion of reticulocytes with highest or high RNA content representing the most immature cells or the just born reticulocyte. Most immature means just born reticulocyte. Simple. Yeah, write it down. Measured by automated hematological analyzers. Oh, now we are relying on automations for this. Immature RC fraction. Clear? Write down the measuring and the normal value. And clinical significance, you already know. So, clinical significance, write it down, increased earlier than total reticulocyte count in bone marrow suppression, from bone marrow suppression. Useful in monitoring bone marrow transplant engraftment, erythropoietic therapy, early response to iron resource therapies. Yeah. Okay, this is the significance of immature RC fraction. Immature RC fraction. Clear? Next. Normal ranges you already know. I'm not going to touch this again and again. Okay? So, yeah, do you want anything? Right. Clear? Yeah. So next will be very basic. So clinical significance we know, reference ranges we know. Then increased counts. In what condition we will see increase? I already discussed. Increase will be seen in severe hemolytic anemia, acute blood loss, post treatment, recovery from bone marrow suppression, etc. Okay. Yeah. So and decreased reticulocyte count. Tell me without checking anywhere. In what conditions reticulocyte will decrease? Aplastic anemia, leukemia, bone marrow failure, Fanconi anemia, thrombocytopenia, even in some infections such as the dengue. Dengue virus particularly targets, dengue targets platelets, I confuse. Okay. So yeah, decreased reticulocyte count conditions. These are the decreased conditions. Our classical myelodysplastic myelofibrosis, bone marrow fibrotic conditions as well. Pure red cell aplasia. Do you remember what is aplasia means? What is aplasia means? Tell me. Do you remember my first class? Dysplasia, aplasia, hyperplasia. Aplasia means decreased count, severely decreased count. Okay, yeah. So pure red cell aplasia, myelodysplastic syndromes, iron folate B12 deficiencies, bone marrow infiltration such as leukemias. That include leukemia, lymphoma, carcinoma. Okay. Lymphoma means lymphocyte cancer. Carcinoma means it can be other than blood cells. Okay. Maybe there are matrix cells. They will. Clear? These are the decreased conditions. Next, a brief overview about the type of test and its clinical use and what it reflects, right? And what else? Lab reports, how we will give the lab report. What are the limitations and sources of error? Some of the limitations include poor staining quality, inadequate mixing of stain and blood. Okay, there are counting artifacts where the Howell-Jolly bodies looks like a reticulocyte. Do you remember Howell-Jolly body, which is an inclusion body of the red blood cell? But Howell-Jolly might look like a reticulocyte also. So we need to be cautious with inclusion bodies from reticulocyte and incorrect calibration of the machines. Right? So this is all about reticulocyte count. Right? So a quick summary. So what are the 6 types of or 5 types of reticulocytes we have? Reticulocyte count, absolute reticulocyte count, corrected reticulocyte count, RC production index, then immature RC fraction. Right? What test will determine the bone marrow? What test will determine reticulocyte in presence of anemia? In presence of anemia. Yes? Corrected reticulocyte count. Okay? What test will determine the real-time monitoring of production of reticulocytes? Of course, you know reticulocyte production index. Right? What lab test will show the earliest immature reticulocyte? The earliest, the most immature reticulocyte. What? Image, I'm using immature, okay. Anyway, you got clarity, right? Yes. In what lab test hematocritic value taken? Yeah. Hematocrit means always keep in mind anemia. Anemia means hematocrit. So definitely anemia related will be CRC. In CRC we are using hematocrit values. Clear? Then in what lab test we are using 1 microliter of blood? Absolute reticulocyte count. In what lab test we are using, what is the formula of immature RC fraction? There is no formula, I guess. It's automation based, right? What are the stains we used for RC count? Supravital stains such as nucleus blue and brilliant result blue. Numerical blood, brilliant result. Very good. So that's it. Thank you so much for today's class. Let me take a